Hi, in this video I will demonstrate you mechanism of labor in breech presentation, and it is the one of the commonest malpresentation in which the fetus lower part, that is the buttocks, and the legs delivered first. So before I start with the cardinal movements, let's see what are the conditions in which the fetus lies. Here the lie is longitudinal, presentation is the podalic pole, it means the buttocks overlies the lower pole of the uterus. The denominator, that is the bony fixed point, is the sacrum, and the position are the four. The commonest position is LSA, it means left sacro-anterior. So the sacrum is directed toward the left side of iliopectineal eminence. Second position is RSA, in which the sacrum is directed toward the right side of iliopectineal eminence. Third position is RSP, right sacro-posterior, that is the sacrum is directed toward the right side of sacroiliac joint. And the fourth position is LSP, that is sacrum is directed toward the left sacroiliac joint. There are many varieties depending on the attitude and the presenting part, and this variety is complete flexed breech, in which all the limbs are flexed together at the joints, and the presenting part are external genital regions, two buttocks and the legs. The another variety is incomplete breech, in that there are again three conditions, that is this one is the frank breech, or you can say breech with extended legs. So here the legs are extended at knee joint and the thighs are flexed at hip joint, and these are directed toward the trunk. The next incomplete variety is footling presentation, and in this presentation both the legs and thighs are partially extended. And the last variety in incomplete is the knee presentation, in which the thighs are extended but the legs are flexed at the knee joint. So the knee presentation or the footling presentation is the rare one. So here I will show the mechanism or the cardinal movements on LSA position, that is left sacro-anterior. So sacrum is directed anteriorly toward the left iliopectineal eminence. Before I show the cardinal movements, just see the movements takes place on three positions, that is first on buttocks. So first the buttocks and the leg deliver, and then on the shoulders, and last on the head. The first movement is engagement, and the engaging diameter of the buttocks is the bitrochanteric diameter. It is the distance between the farthest point of the trochanterus of the femur, and it is about 10 centimeter, and this engages in the left oblique diameter of pelvic brim, and it starts from the left sacroiliac joint till the right iliopectineal eminence. So here the engagement occurs. After engagement, descent takes place, and as the anterior buttocks touches the pelvic floor first, the next movement occurs, that is the internal rotation of the anterior buttock. So the anterior buttock rotate 1/8 of the circle and comes behind the symphysis pubis. Further descent takes place, and with the increasing lateral flexion, the posterior buttock releases the lower limb, and the anterior limb is also released here, and after that restitution takes place, that is the passive movement of 1/8 of the circle, and it places the buttocks in the same alignment as it was at the time of engagement. With this restitution, the next part engages, that is the shoulder, and the engaging diameter of the shoulder is bisacromial diameter, that is the distance between the two farthest point of acromial process of shoulder, and it is about 12 centimeter, and this engages in the same oblique diameter as the buttocks was, that is the left side. So the engagement takes place, and after that the descent occurs. With the descent, as the shoulder touches the pelvic floor, internal rotation takes place, that is the 1/8 of the circle movement, and finally it comes behind the symphysis pubis. And externally the lower limbs also moves. Now this diameter lies in the anterior posterior diameter of the pelvic outlet. As it reaches the subpubic region, the anterior flexion of the trunk occurs, which help in the release of posterior shoulder first, and after that the anterior shoulder also releases, and the next movement which occurs is the restitution. With this restitution, the next part which engages in the pelvic brim is the fetal head, but here the fetal head occupies the opposite oblique diameter in pelvic brim, that is right oblique diameter, but the shoulders and the buttocks was lying in the left side. So in right oblique diameter, the engaging diameter is the suboccipitofrontal, that is about 10 centimeter. After engagement, descent takes place, and further it rotates 1/8 of the circle and comes behind the symphysis pubis, and externally the trunk as well as limb also move, and finally these lie in the dorso-anterior position, and then flexion takes place with somewhat suprapubic pressure. The flexion maintains, and finally the chin, face, brow, sinciput and the occiput releases by the movement of flexion. As the head is more difficult part to deliver in comparison to the shoulder and the buttocks, but they are longer but easily compressible. So to deliver the head vaginally, there are the three methods. First method is the forceps delivery, in which forceps can be applied to this head region, and with a controlled manner head is to be delivered by maintaining the flexion. Second method is Burns-Marshall method, in which baby is hanged down by its own weight and one assistant is called upon to give suprapubic pressure in downward and backward direction so that flexion could be maintained in sinciput region, and by the another hand hold the ankles by placing the finger in between the two, and by creating a wide circular arc move the trunk and the legs in upward and forward direction as the nape of the neck and hairline is visible, and by this method head could be delivered. The third technique is Mauritius Melly wet technique, MSV technique, or malar flexion or shoulder traction method, in which in supinated left forearm place the baby by hanging down their limbs on either side, and place the index and middle finger over the malar bone or zygomatic bone, or you can say the cheekbones, so that continuous flexion could be maintained. And with the another right pronated hand place the little finger and the ring finger on right shoulder and the index finger on the left shoulder and the middle finger on suboccipital region, and by a steady traction a continuous flexion could be maintained and head to be delivered. I hope by this video you can easily perform mechanism of labor in breech presentation on the dummy. So thank you for watching this video. Please subscribe our channel, like the video and click on the bell button.